Good morning, Dr. Richard Buckley and team at MilfordMD. It is Friday. It is nice that it's Friday. It's been such a busy week. So we don't do content every day because some days we just get too busy. Yesterday we did a lipo-abdominoplasty with vasoring and harvesting of fat to then do fat transfer to the face and also hands. And so I was going to show you some fat transfer, but I realized after we did that, we didn't show you that fat transfer yesterday. If you look later today, then I will show you some fat transfer to the hands later today, which is fun stuff, cool. Very persistent, the cells are alive, and the rejuvenation of the hands lasts as long as those living fat cells last. So is that forever? I don't know, maybe it lasts a very long time. Of course, with anything, and it's a common question that patients have, how long does something last? I mean, let's say whatever improvements we made that help people look younger, feel more confident, etc. Let's say those improvements really were permanent and didn't in and of themselves change or go down. Time goes by, right? And so more aging happens. And so if one wanted to keep a particular result, would be unreasonable to expect the things that you did in the past to keep a result when new things are happening to age us all every day. You know, there's upkeep for everything. That's the short version. Today, our patient has a little bit of some extra fullness in her abdomen than she wants. Is that true?
Yes.
Yes. How do you describe it? Is it extra fullness? What is it?
Baby fat.
Baby fat.
From having a child.
From having a child, okay. And she's snapped back very quickly from that and is in, looks like really good shape, but you know, there's some stubborn fat. So the stubborn fat we can help, and you know, you don't make new fat cells after puberty. So the good news is, how are we doing on time? 4? Okay. If we get some fat cells out, those cells are gone for good. Your body's not going to replace those fat cells. So if you gained weight, which you don't want to do, then those extra calories the body would have to store more somewhere else than here. So if there are fewer fat cells here, because we've taken a whole bunch out, it's going to be harder for the body to store fat here in the future. He's going to have a think about where else it might want to store the fat. Anyway, you want to improve your weight to an ideal body weight, or at least maintain the weight you have when you do these procedures, so as to maintain a very nice result. Sometimes skin is young, which doesn't necessarily have anything to do with the actual age of the person. It might have to do with the condition of the skin. So we do see people who have been alive lots and lots of years who have amazing skin that's not bagged out, sagged out. And we also see people who are 20 years old who already have a whole lot of sagging anywhere and everywhere on the body. So there's a big genetic component to how quickly something might sag or bag out. When we're doing lipo, we do, kind of as a high-level thing, have a look at, so what is the degree of the ability of the skin to keep itself tight and lift it up. So we might, if the skin is tight, just suck out the fat that we don't like. So that's contouring and sculpting. Or we might do some kind of a tightening treatment, as we are today. We're doing ultrasound with a vaser, and that vasoring is blasting fat cells off from where they're trying to stay, you know, they're hanging on, and we're just blasting them off. You can kind of see some numbing fluid coming out through my little safety gadget here. It's a little port, it's called, but that just keeps this off of the skin. I take that off when we're done. But there's melted or released fat along with some numbing fluid coming out through that little port. So we're doing vaser in order to get some skin tightening. As soon as I'm done with this vasoring, you can see that's sort of stopping right there. I would like it to be loose everywhere. And if I put it over here where I was working, you can see how that just goes in effortlessly. I'm not even holding the scalpel. Can you see that? Yeah. So, and then it falls. So, but here is kind of stopping a little bit. So I'm going to loosen those fat cells up over there. As soon as I'm done with that, we'll pop under here with some little tools and suck a whole bunch of fat out. And because the fat's going to be loosened up, it's going to come out very quickly. We'll be very excited to watch that fat flying out, and we'll be excited about seeing the result. We can do this any time of the year. There's very little real downtime, I would say, with this. We have people wear a little spanky compression garment afterwards. We don't put in drains for this kind of thing. And they can, go to the gym the next day if they want to. They can go for a run the same day if they want to. Sometimes people try and do contour improving things like 1 week before a wedding, 2 weeks before a wedding. You know what? It's good to leave more time. And what if these usually don't bruise, for example, on the abdomen at all? But we could give one tiny little poke with a needle on the face to do, for example, some facial filler with hyaluronic sugar, like a Restylane, a Juvederm. And that might make a bruise. Just that little needle might make a bruise. You don't need a bruise before a wedding. You don't need to have any extra agita, anxiety, or worries before a wedding either. Obviously the temptation is, I just do this quick thing before the wedding and then that's going to help me feel more confident. Some things can be done, but best to have a plan, not just be trying to quickly change something at the last second. Start sooner, have more of a long-term plan of maintenance and staying looking youthful. I saw a patient yesterday. She looks absolutely amazing. And, she told me, I don't like looking at the chart to see how old people are, but she told me when I asked that she was, well, in any case, she looked amazing. So that's the first thing. She just looks young, skin's in great shape, everything's great. And she's in her mid-60s. And then she said, well, yeah, sure, you did a brow lift, and you did my eyelids, and like face neck lift, and yeah, but you know what, there isn't any evidence. I mean, I guess if I put on high-powered lenses and look carefully, I'll see, maybe some tiny little scar, but to the naked eye, you don't see anything. So, you can't see any scars anywhere, so that's her perspective. And I think that's very nice, if we can help people look amazingly younger, 10, 15, 20 years younger, and they don't look weird. The idea is to help people look like a younger version of themselves. Maybe with some tweaks, so if there was something that they didn't like from when they were younger, we often do some little thing to improve that. But the main thing is just to kind of undo whatever time has been doing to us. There's just typically some volume loss, some sagging, some development of folds, like nasolabial folds and marionette lines, and the subcutaneous fat goes down, and of course the skin thins, and the muscles under that tend to thin, and the bone under that is resorbing, so everything is sort of like shrinking away. And we can help to restore that. As I said, not a good idea to do it all at once 1 week before a wedding. Better to have a plan. A lot of times people ask about price. We're all price conscious. I think that's sensible. I'm not sure that has a whole huge amount to do with how people should make decisions on cosmetic procedures. I understand the temptation, but people should really figure out who they trust and just go there and have that person who's very experienced give an opinion I mean, I love hearing from my patients, especially what's bugging them, and their ideas of what they think maybe they need, because mostly people have done some kind of homework. That's all good. And then there's the fact that, you know, we've been doing this stuff for decades, actually, and all day, every day, actually, and hanging out with our peers in the world who are doing all this stuff every day, and to, you know, an amazingly caring and high level, then you'd think that you'd want to just ask that person, well, you know, in order to help me with this thing I don't like, what do you think, right? And so I would encourage people just to go someplace where people there care about you and really, and where they have a ton of expertise. They may well have a lot of tools, like we have 40 lasers. I would say, yeah, so what? It doesn't mean that all, your hand is over the camera there, you gotta put the finger down. So, you don't need our 40 lasers, but maybe you need one of them or two of them, and you wouldn't be the right one to decide that. Dr. Marina Buckley would be, or I would be. You just have to come and ask advice, guidance. It's good to get guidance from people who know the ropes. So my staff is actually monitoring what I'm doing, and this vasoring is being timed. You know, it's way too much information for you, but we kind of do maybe 60 seconds to 90 seconds of vasoring energy per 100 cc's of tumescent fluid that we put in. So like over what area is 100 cc's? Well, I don't know, maybe that much here, but you know, that is a bigger area up here that energy would be spread over. So yes, it's actually complex, and it's very varied. And in the beginning, I guarantee you, people don't do this and chew gum or talk. But eventually, we do both. So today is Vaser Lipo Sculpting. What's the difference between sculpting and sucking? I don't know. Sculpting sounds like it's probably a detailed thing, trying to achieve some particular contours. And if you look at a statue, it's been sculpted. And so, much as, you know, those who work, say, in stone, need to look at the stone and envision what is in that stone that they're then going to release from the stone, right? I need to do the same thing. So it's not just about sucking some fat out. I need to see, in my mind's eye, where I would like to take the sculpting here. And then I need to get that stone off. And then we've revealed the new woman, right? Is that right?
I hope.
You hope. Yeah. Are you comfortable, by the way?
Yeah.
Yeah. So we have an awake, comfortable patient who's been stuck listening to me. And appreciate you guys watching. If there's some things you would like us to show you, and if there's some things you would like us to talk about, please drop us a line somehow. Call us, email us, text us, leave some comment here in this Instagram or Facebook or wherever you're seeing this. And we will try to incorporate that into some future filming. All right? So thank you for watching. Milford, MD.